It is November 19th. Today's my post-op appointment. I had double incision top surgery with Dr. Sussman on Thursday, the 15th. So today I'm going in to take these bandages off and get the drains out.
And then you have these little tie-down dressings over the nipple area.
Probably what's feeling like pulling.
It's a little pulling. Those are sewn in place. Those are going to stay on for a few more days. It just helps to keep the graft in place and helps it to stick down. Okay, so I'm just taking the velcro off. That'll probably feel better. Bring your arm out here. So far this looks great. You have some swelling, as expected, a little bit of bruising. And because of gravity, all this swelling kind of settles to the bottom part of the incision, so that's where you're getting a little swelling down here.
Should I lay upside down?
No. So you can shower after today's visit. I'll write everything down for you. These dressings will stay in place. They can get wet in the shower.
Oh, okay.
And then you'll just kind of gently squeeze the excess water out of them. The mirror.
This is like an integral moment. You know, all over the internet, they're like, the drains hurt the worst, taking them out.
It's tough because plenty of patients don't feel the drains coming out. Some do feel that sharp pain. In a stitch right now. What you do is you're going to take a deep breath in, and then as you blow out through your mouth, I'm just going to gently slide the tube out. It's also not a very big tube, so I think that some of the things that people, say about the tube. Ready?
I don't know if I'll be ready. You tell me.
Big breath in, and blow out slow through your mouth. Go. That's it. That's it. Was that as bad as people say?
All right, internet, you're all lies. That wasn't bad. And that just closes by itself?
Yes.
All right.
It's putting a little bacitracin on it. It's a little gauze just to cover it. If you were to look really closely at it, it would look like a hole right now, but it feels from the inside out.
Mm-hmm. Makes sense.
Great. When you're ready, big breath in and blow out. That's it. Feel that one a little more?
Yeah, that one's a little tender on the outside.
You have a normal amount of swelling. No concerns about infection. No concerns about, excess bleeding. You're nice and symmetric. Your incisions are all together. So all good stuff so far. They can get wet in the shower. You'll just feel a little more like yourself.
Yeah, I already do. It's already better.
Flip this over a little bit. So far everything looks perfect.
Mm-hmm.
And that should be fine.
Cool.
Ready?
Yep.
Okay.
Cool.
Ta-da!
Let me just disclaimer this. I wanted to film more than what I actually filmed in there, but because it's a policy of the facility that my doctor works for, they don't let you film. I got the tubes out. Okay, so we'll take this off too. Okay, so this side is more swollen. This is covering up the drain hole, okay? This side, same things, cover up the drain hole. This one's a little puffy, which makes sense. So while I was draining, my left side was draining a whole lot more than my right side. And it was actually, at the time, I was like, ooh, this is draining a lot. This is like, makes me feel like it's not cool, but it's good, obviously. That means the swelling went down, is a lot, significantly less here. The scars, which I can't take this tape off yet, but they're very, very much 3D right now. They're pretty, not gonna lie, like I was waiting for some Frankenstein shit. Take these off too, because drains coming out didn't hurt. Cleaning all around here didn't hurt. So yeah, I have to wear a compression vest though. This is my chest. Wow, it's pretty thin. That's not bad, not too fucking shabby. I didn't have any, like, holy shit, I'm gonna cry from happiness moment. It wasn't like that. It was more just like, Jesus, about time kind of thing. I feel more poor that I spent the money to do this because I feel like I basically just feel like how I feel like I should have always looked. You know what I mean? Does that make any, you wouldn't understand if you wouldn't understand if you were looking at this video because you just knew me. I never got any pleasure either. So it was a big fat inconvenience. Now that I have a regular dad bod, I feel like awesome. Now I can just put a shirt on and go. I don't have to worry about anything. I feel good. I'm not in pain. And I'm gonna, I mean, the journey's not over yet, we'll put it this way. Who knows what the fuck could happen to these nipples? You never know if they're gonna fucking fall off or not. You never know. This is 4 days post-op. We're gonna get a lot better, don't you worry. And that's all I gotta say. We're done!